Hi friends, my name is host Eric, and I'm going to make a set of videos, probably 4 videos. And the topic for these 4 videos set is ADD is totally bullshit. ADHD, totally bullshit. Not one speck of anything to it. So I will explain why, but I'm going to do it in 4 parts. The first part is going to be backstory and context, and struggles and stuff like that. It's going to be basically all the reasons why ADHD is not bullshit. And then part 2 will be about Dr. Russell Blakely's presentation and about the PDFs that I've recently been reading here this evening as I've been doing some research. Part 3 will talk about the importance of a meta framework and why existing psychological diagnoses are a farce. Number 4. Number 4 is I'm gonna show you what it looks like if instead of Dr. Russell Blakely doing the lecture about what he did, I'll turn it and say, okay, well, let's pretend I was doing that. Let's apply reciprocal burdens to you, and we'll see how it sounds. All right, this is part 1. It's backstory. It's road mapping. I gave you the roadmap there. We've got 4 parts. I'm going to try to stick to it as best I can. This first part is background and context. So, context. I been getting increasingly interested in this notion of ADHD actually being a thing. Now, you might note that I've been diagnosed ADHD and I take medication for it. So how could I possibly not think it's a thing? Well, to be perfectly honest, when I went to go get medication for ADHD, that's what I went to do. I didn't go to get my ADHD treated. I went there to get speed from the doctor. And my reasoning for that was I'm not getting anything done. Delilah, we put her on it, and I like that shit in general. I'm gonna go get some speed. That's what I thought. So I had to go to the doctor, though, and I had to tell him a story that would convince him that, in fact, I needed speed. An interesting verb, but let's just move forward. So did I need speed? Well, I don't know. Well, but that's not the point. The point is, what did I tell him to convince him that I needed speed? Well, I went in there and thought about it ahead of time, and I cherry-picked out some evidence. And this is my way of thinking about it at the time. I'm going to look back over the course of my life. I'm just going to cherry-pick actual events that line up with what they think ADD is, or ADHD, or whatever you want to call it. And I'll just I know how to position the story too. I know how to position everything. I'm gonna go in there and I'll just do my thing, right? I'm not gonna have to lie. I don't want to lie. I shouldn't have to lie to get what I want. I mean, do you have to come have me write something on a piece of paper if you want to use your lawnmower? You should. Well, why do I have to get something on a piece of paper from you just so I can get some speed? Well, Eric, you're not supposed to want speed. Okay. Well, I did. And that's why I went to the doctor. Now, what didn't really occur to me, or I guess it occurred to me, but I didn't have any clear course of action to resolve the contradiction, so I just sort of left it alone. Was the fact that the story I told was true, it was there weren't facts in there that didn't happen or anything like that. I framed it maybe and to highlight those aspects of it that were most consistent with ADHD. I looked at descriptions of the disease, quote unquote disease, before I went to the doctor, but I knew already basically what it was. I'd had people call me ADD before. That started right at the beginning of our marriage. My marriage with Candace, not even the marriage part, the going out part. She was talking about me being ADD. And I was right from the get-go saying, Candace, that's not actually a thing. That's just made up nonsense. That's what I was telling her, right from the beginning. Well, it was at her, not insistence, but she was the driving force behind Delilah eventually getting on medication. We looked into it a little bit in middle school, and then we ended up putting her on it when she started flunking in ninth grade, So, well, that's how long I've been on it too, basically. A little bit less than she. So, she started taking it a little bit into ninth grade, like maybe Christmas time in ninth grade. She's now, we'll be coming up on Christmas time of the year after high school. So, 4 years. And for me, probably 3. Here's the deal with that, though. So, what story did I tell the doctor? I'll give you the whole spiel as quickly as I can. Look, doctor, we just put my daughter on the medication about 6 months ago or whatever. We've seen remarkable change. It's been absolutely amazing. I never thought blah, 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 blah. Now, here's my sob story not sob story. Here's my good news part of the story, which is I've not that long ago changed jobs so that I'm full-time over here at Kudos, and I'm no longer working at the other school I used to work at. And now as a full-on director position, I've got all this new amount of work I'm supposed to be doing, and I really am having a hard time. There's not the sort of social engagement aspect of my old job. All this shit was true. Sorta. True enough. True-ish. All the facts were true. The interpretations were framed, but more or less true. So, that naturally brings up the question, well, Eric, if in fact you can accurately and fairly and truly say, yes, I'm experiencing all these symptoms of ADHD, then can't you accurately, fairly, and truly say that you actually do have ADHD? Okay, fine. Well, we'll get to that in the next thing, or the next one after that. Sure. Let's try to stay on this organizational scheme. So that ends that part of this background story. The other part of the background story is Enid F. Patterson's message to me. She sent a message using YouTube messages. YouTube messages, as I understand them, are for when you want to talk to somebody, but it's not about a specific video. So you don't want to comment on the video. And you could do it on the channel page, I guess. Sometimes people do comment there, and that's really neat. But regardless, I don't even know. I haven't even looked to see what the comments are on that thing. But she freaked out. She totally freaked out because I revealed something about her or something. I don't know. Fucking, that's another video. That's down the line, though. We're gonna do a video on privacy, and after I finish these other ones. So, okay, so she's freaking out but even though she said in her message, that she outed herself on her channel. So I thought, oh, well, I guess that means it's open now. I don't know. Anyway, I only read like 2 or 3 lines from her freaking message, and they were banal things. And there wasn't anything bad in those messages at all. It was just like, it was like good, noble, earnest, well-intentioned shit that she was saying. And she wasn't saying like, and then I got raped by 50 guys or something. You know, it was like, well, there was nothing specific personal to her. It was an exercise in prose, for God's sake. And she surely knows that. Enid F. Patterson. I'm going so easy on you, dude. I am taking it so easy on you. Oh, I'm being so nice to you. I like you. That's why I like you, Enid F. Patterson. Anyway, I'm not going to get into the whole prose thing right now. So that's the backstory. I, host Eric, am diagnosed with ADHD. Probably the doctor would pass an examination of his doctoring skills in that area, because other doctors, if they were sitting there watching that, would agree with him that in fact it's an appropriate diagnosis and an appropriate prescription to write. So, after I was prescribed initially Concerta, I worked my way up to 15 milligram Adderall twice a day. I'm not going to even ask for any more than that. I had, but see that, now this is an example of an ENTP being manipulative. I wouldn't do it, I can't even conceive of doing it for most things. But for drugs, I could conceive of doing it. And in fact, I did. And the way I manipulated was I intentionally asked for the kids one first, saying to the doctor, I'm really kind of hesitant on these kind of things. And, you know, let me just try the kids one first, and hopefully that'll work. Knowing that I was going to put in a month on that, come back to him and say, I hate that shit. I want Adderall. And the reason I'm just calling it by name is, well, look, I've done some research now, because I didn't like this concert stuff. I did some research, and I want to try this Adderall stuff. You know, like that kind of a thing. And then I knew I was going to go 3 months on one pill a day, and then I was going to say, I had the script, right, already in my head. It starts to wear off around this time. And it all worked as I intended it to. Now, again, there's this weird issue of, well, Eric, are you committing a crime there? You know, lying to a doctor to get drugs. Why do you think I'm lying? I don't even know if I'm lying. I knew that I knew going in I wanted 30 milligrams a day. That seems like a good amount to have. Was it? But Eric, that's not how it's supposed to work. Look, you can't illegally mandate that I not engage in metacognition. I dispute the legitimacy of any of these claims to restriction on my access to things anyway. So, I mean, I don't know where... I would love to see... I'd love to see them try to take this into a courtroom and bust me on it. That'd be hilarious. They never would. It's too mushy. But, that'd be great. I'd love that. Regardless, so that's where we are now. That's the same amount of speed that I'm on that I've been on for like a year now, and it's fine because I actually, to be perfectly honest, although they're not normatively in the right to restrict my access to it, I'm happy enough with the setup because it allows me to know exactly how much speed I'm going to do a month. And B, addicted-y to it, I guess. I mean, to behave in an addict-like fashion with it, but it's a million miles away from smoking meth. I'll tell you that. Having been an actual speed addict, I can tell you that taking the amount of Adderall that I take is not even on the same planet in terms of the experience. You should note, though, that in terms of the actual drug, on a one-time to one-time comparison, if you take a lot of it, and you don't even take it that much, really, you take 3 or 4 of them or something, it is not one iota different from meth. It's exactly the same fucking shit. It's not chemically exactly the same. Adderall is a combination of 3 different kinds of amphetamines. Meth is one kind of amphetamine. And meth is... it's not inherently any different than Adderall. It has the same impacts, feels the same, more or less. I kind of like Adderall better. But the big difference is this. It's a matter of dosing. It's like dosage and medium of consumption. Because obviously I don't smoke Adderall. And I don't have a glass pipe, right? I don't have a glass pipe here where I'm smoking Adderall. I definitely had glass pipes when I had meth, because that's 99% of the time how I consumed it, was smoking it. Smoking it is a very different experience than eating it, which is what I'm doing now. I did submarines before as well with meth, and that was very different experience too. It was more like Adderall, way more like Adderall. Just because when you're... the drugs are the same, but how you take it, they're more or less the same. I think meth might have a longer half-life or something. Do they measure this thing at half-life? I think so. Which are just radioactive drugs. Anywho, yes. So, don't do meth, kids. Visit your local doctor instead. And you'll find the experience much more sustainable, as well as satisfying. So that's the background story about my ADHD as an adult. As a kid, my remembering of my ADHD quote-unquote symptoms is summed up simply as, I don't want to fucking do that. That's fucking boring. And or pointless. So, okay, that's been part 1. Let's see. Eric seems to be going somewhere with this. Yeah, I am going somewhere with this.